Therapist Thrival Guide, where we cover all of the things that graduate school didn't teach you. All right, welcome to the Therapist Thrival Guide. My name is Miranda Barker. I'm a licensed clinical social worker, and I am joined with my co-host, Dr. Lucas Volini.
Hello.
And with us today is the amazing Kyle Ross. Kyle, can you introduce yourself?
Hey everyone, thanks for having me. My name is Kyle Ross, licensed professional clinical counselor, and been with Ellie since the beginning, so about 7 years.
The first employee, or the second?
Second.
I was going to say the first was Faye.
Foot's the first employee. You were the second employee.
Yeah, I think Faye was there maybe like a month, and then Kyle and Aaron reached out.
So number two, I have no idea how many employees we have now.
Oh my word,
Hundreds.
I have no idea. Hundreds.
So many.
It's like
Amazing.
200 something full-time therapists, and I think it's probably pushing close to 300 in total for everything.
Wow.
That's
Cool.
incredible. Well, you were number two of all of those.
Yeah,
Your first Ellie podcast.
Mm-hmm.
All right.
Yeah, it was wild. When we started, there was literally 3 offices in St. Paul. So Kyle Keller would finish, it was either at like 4 or 5 o'clock, and then I would, after my school-based job, come and work from like 4 till like 9 at night.
Oh, wow.
Yeah.
And so we were like all office sharing out of those 3 offices.
So what do you do now?
What I do now is mostly focused on enteropsychedelic therapy. But I think over the years, like when I came onto Ellie, it was to design and develop and run all of our community-based services.
Okay.
And I did that for probably the first 5 years, and then was always on like the senior leadership team. And then over the last 3, moved more towards just organizing and managing all of our psychedelic medicine,
Awesome.
things like that, and then just kind of play a hand in some of the other things that we do.
Very cool. Well, we're happy to have you here today. So today we want to talk about navigating tragedies. And we want to talk about this in a couple of different ways. Like if you as a therapist are navigating tragedies in your personal life and, still needing to show up for your clients. And then on the other hand, if you are working with a client who is navigating a tragedy during your work together.
Yeah.
So, Lucas, what do you want to say about this topic?
It's a challenging topic. Kyle Ross, this was kind of your pitch, to dedicate an episode to this. It's something I don't think I would have thought of. But as soon as you mentioned it, I certainly was able to recall experiences of my own relative to this topic. And yeah, kind of at that intersection of, tragedies in a client's life. And, when we say tragedy, we're essentially talking about like really bad things that happen unexpectedly. Right? Is that kind of where you're wanting to go with it?
Yeah, definitely.
And so sometimes it can be something that happened in a client's life that they bring up. Sometimes it's something that happens in our life, when we're in the midst of a busy client work week. And then I would say there's a third dynamic, which is probably the first thing I thought of in my clinical practice when thinking about this topic. I do a lot of relational work, and when a tragedy strikes a relational unit that you're working in, so it's and like essentially when you're working with a family and a member of the family unexpectedly dies, so kind of you have that relationship with the client on a personal level. And so there is kind of a component of, kind of the client's crisis and the provider's crisis colliding in some degree when you're doing relational work. And so, yeah, I think it'll be helpful for us to kind of dig into it and give folks a sense of, being prepared for when it does inevitably pop up either in their clinical work or in their personal life.
What drew you to this topic, Kyle?
I think that there's one particular situation right when I was in the middle of grad school and like was in my first internship where the very first therapy client I ever had did the intake, talked about depression, PTSD, and then about a month later disclosed that he had stage 4 cancer. And so the very first person I worked with, we got to work together for about 18 months and he passed away. So I think in a number of ways, that experience and helping, I don't know if helping him is the right word, but working with him as he was approaching death has always been something that I cherish, just in the way that I think that was probably the greatest learning I ever had in learning how to work with people, and in a lot of ways probably redefined what I think therapy is. Like, I think I had this comprehension of what it was while going through like normal academic learning, and then all of that felt like it didn't even approach what the actual work was. So I think that was a big piece of it. And then about a year ago, I had a really big tragedy in my own life that we can talk a little bit more about later, where I think one is on the client side and one is on the clinician side. But I think that Lucas makes a really good point that inevitably, unfortunately, people have experiences in their life where there's going to be a tremendous loss. Things that are difficult to speak about or even wrap your head around if you can. And I think as clinicians, we have to have a way of conceptualizing that for ourselves and for clients to be able to navigate that.
Wow. Yeah. I mean, I'm a fairly new therapist, and so I have not had to navigate tragedies with clients yet. And so I can't say I'm going to be super helpful with this episode, but I feel like this is so important just to kind of take in this information and prepare yourself, because you're right. It is inevitable. It's going to happen. So where should we start? Where do you guys want to go?
I'm curious to learn more about kind of where you started, Kyle, and to expand upon, well, that's an incredibly challenging initial client to have when you're first getting into this work. There's a lot of complexity to somebody who's terminally ill, and they know that they're anticipating, kind of the end of their life, and they know it's ahead of them. It's predictable. And you said it was a pretty powerful learning experience, which, yeah, I imagine it was. But when you said you kind of had a kind of comprehension of what you thought therapy was, and a big outcome of that experience with that client was kind of altering and changing how you perceive therapy and what therapy meant for you. And so, yeah, I'd love for you to kind of expand upon that one.
It came into focus because I think I went in, did a diagnostic assessment, did all of these things that we're trained to do, and went in with this idea that you would create a treatment plan, you would have outcomes measures, you would pick a theoretical orientation, and you would use that to help someone. And I think that, like, what ended up happening is as you get to know this human being who is going to die, a lot of that none of it really made any sense. Like, it was the first time that I encountered a client situation in which, what is resolution? Like, you're sitting across from a person who, and I can talk more about his life, it was just, to be honest, tragic from birth until 58 when he died. And so what is resolution to that? Like, what is sitting down and saying, I'm going to use this intervention and help him reframe that?
Yeah.
And then when you when you're about to say the words to help him reframe it, you're realizing that you're asking a person to reframe a life of tragedy with the ultimate conclusion being death. And then you realize that you can't possibly do that, or that would be horrible to try to do that.
Oh, yeah. That reminds me of a paper I wrote in my master's program. It was with a faculty who was a pretty dedicated solution-focused therapist, so a lot of the teaching was on solution-focused therapies. And so the final paper was like an application of solution-focused therapy, and I ended up titling the paper, "What is the solution to our mortality?" Because that is where because I was already kind of getting into existentialism at that point, which I found far more interesting than any of this assigned readings in the courses I was taking at that point in my education. And so yeah, like that notion of like pursuing the solution, you know, and making it better and reframing things to be more positive, you know, and then right off, that's what a lot of graduate school prepares us to do. And like with solution focused therapy in particular, I think a lot of emerging therapists gravitate toward that because it's tangible, you know, it's there's not as much complexity to it in a lot of ways. I think that's fair to say. And so it allows you to kind of feel effective and have a grip on the work that you're doing with clients. But I always found it to be incredibly constrained, especially when it comes to issues that, well, one, don't have a resolution, you know, such as mortality, but also, you know, with clients who aren't necessarily interested in a solution to their problem, they more so want to just reach a deeper understanding of their problem. You know, and so it's sounding like the shift for you in therapy was kind of starting off approaching it with a mindset of how do I help my clients fix their problems and resolve them, to how do I help my clients come to embrace and accept some of the brutal truths of the world we're living in.
I think what was interesting in my work with him, like I agree with everything you just said. Like, I think what I found most interesting after working with him for a year and a half is it was easier for him to accept that he was going to die from cancer than some of the things that had happened to him in childhood. A lot of abandonment and estrangement and neglect and abuse from family. That was something that he would very much state, like there was no way for him to accept that he could accept that it happened, but he couldn't accept that there was a logical reason for it.
Yeah.
But was actually easier to accept mortality. Terrified of it, but that made more sense than some of the things that had happened to him early on. And part of me thought, like, through therapy, can we learn to accept the things that have happened to us? And I think depending on the person, and I think depending on the things that have happened to us, the answer is yes. Like, I think a lot of therapy is how do we make sense out of all of these things that have happened to us in life. And then I think when it comes to really intense tragedies, I think there are some that I don't pretend to have a perfect answer on that, even for myself, that I don't know that there's a lesson to be learned from it. I think we live with it and have to learn to live with it. And some days are going to be much easier than others. And I think that was the shift in working with him, was the acceptance of my acceptance of being very uncomfortable, that there was no resolution.
Yeah.
And that itself, in a strange way, kind of is a resolution, to accept that that's the reality.
Yeah. So I'm already pretty quickly seeing how powerful kind of countertransference can be in these situations when it is a client tragedy. Because how could you possibly be effective in helping a client come to terms with their mortality unless you've come to terms with your own mortality?
I think there's a lot of ways to take that. And like the first thing that pops into my head is I think sometimes there's like the old psychoanalytic views that we are completely perfectly neutral. And it, to me, it's just the greatest fallacy that exists inside of therapy.
Yeah.
I'm
therapist neutrality.
I was teaching a class at St. Mary's last weekend, and I kind of just openly said, and I was like, you know, raise your hand if you can be objective in therapy. And about a third of the hands went up, and it was like, not trying to burst a bubble or be mean, but you can't.
Right.
And I mean that in the most caring, thoughtful way, that I am a human being, and if I hear something from another human being that they're suffering, I'm not neutral in that. I want them to feel better or come to a new understanding of it. And I think it's about the volume of objectivity. Like, I did need to be objective with this person enough to be his therapist. But I wasn't objective in the way that there were several times you'd walk out of that session, and especially towards the end, like, done for the day, get in your, it was in home. So like get in your car and cry for 5 minutes before you start driving, because it was just sad and it sucked.
Yeah.
But I think that's one of the reasons that I am a little bit passionate about this subject, that too far in either extreme is not a healthy thing. We can't be so objective that we're pretending that we're robotic, but we can't be so emotionally distraught, I guess maybe is the word, that we're not effective in helping that person. And somewhere in there is a healthy balance. Because at the end of the day, I do have to go home and I do have to be present for friends, family, school, whatever it is that you're doing. We do have to have a way of living our life as well.
Well, and I would imagine too that you need to show that you're caring for this client without being overly distraught to a point where they need to either comfort you or try to like downplay it or take on a different role in that setting.
Well, and I do think that happens in therapy, right? Like I don't think it's a good thing, but I do think that sometimes there's this view in our field that empathy is the greatest tool. And part of me would want to say it is a tool, but it is not. Sometimes it could be taken too far because if we have so much empathy that we're so emotionally impacted that your client is now feeling the need to help you.
Exactly.
Then we are not.
Right.
Now we kind of went to that too far to the extreme that we're not effective. And that would be not the reason a person enters therapy.
Yeah, and I think therapists can be susceptible to moving toward that extreme form of empathy, that kind of levels the suffering within the space, which positions the client to feel as if they need to care for the therapist, that we're more likely to find ourselves there when we're dealing with issues that we've never confronted ourselves or we've never examined ourselves, or we feel just as helpless to it as they feel.
Mm-hmm.
And then so empathy even becomes tricky in that sense too, as far as like, is it really empathy at that extreme, or is it truly just your own suffering spilling out into this therapeutic space?
I would agree with maybe the latter at that point.
Yeah.
If it goes so far, well, and I think words are tricky because like if I say empathy and you say empathy, almost inevitably they're different.
Yeah.
There's a core understanding that we all share. We share a mutual reality, but how we utilize that is different. I would almost say when you talk about it that way, we have sympathy.
Mm.
And I think going too far down the sympathy path, I think then we become less effective as therapists.
Yeah. Yeah.
If I start to pity you,
Yeah.
now I will not hold you accountable. I won't press on something for you to do better or learn new ways to do things. I'm going to see you as inferior.
Mm-hmm.
Oh, yeah. And I'm not going to believe in you.
I think that's
and like the extent to which the therapist believes in the client, I would say is the threshold that the client can grow to.
Absolutely. Well, I think that's like Viktor Frankl in a nutshell, right?
Yeah.
Like there's a really cool YouTube video of Viktor Frankl teaching a class. It's in like black and white and it's like crackly, whatever. But he talks about how he was learning to be a pilot. And when you're learning to plot out a course, you overshoot when you're learning to fly a plane because of like earth curvature, all of that stuff. But he said that was one of the greatest things he realized is I always overestimate my client's ability because if I do that, they hold a belief and inevitably then they get to where they are capable. But if we don't hold that faith in them, often we might be one of the only people in their life that actually does have that faith in them.
Mm-hmm.
Yeah. Yeah. And tying this back to tragedies, I would say one of the biggest complicating factors would be when the client experiences a tragedy and they tell us about it, and our initial thought and reaction is questioning our own ability to cope in their situation. You know what I mean? Like if we're left with a sense of, oh my gosh, if that happened to me, I'd be a helpless mess and lost, and I wouldn't be able to cope. I would be destroyed, and just deteriorate as a result of this. That's going to get in the way of being effective, and being present with them in the way that they're coming to you. And so maybe that's a good question too. Like when clients experience a tragedy, what do we think it is that they want from us? or expect from us or need from us as their therapist?
I think sometimes it depends on how you've been doing therapy with them in the first place. Like, there's an awful lot of, like, I think there's a huge variability in what people come to therapy for. There's many types of therapy. And I don't mean like modalities or theoretical orientation. I mean, like, there are some people that come, they need a place to vent and just kind of process a little bit, get some affirmation, and they're kind of out the door, and like it just holds them in a stable position. I think then there are clients like my client who passed away, that was, for lack of a better way of saying it, soul work. That was, and just for like a little context, was a guy who grew up in the deep South, closeted gay, joined the military, was given up to an orphanage at 7, but the other siblings weren't. It's a lot of abandonment, physical, sexual, emotional abuse. Military, he actually said, although being closeted sucked, actually found it to be one of the greatest things. He got stationed in Australia, loved it. When he got back to the States, met someone, they were in a partnership for 20 years and came home one day and he had hung himself.
Oh my God.
And so I met him about 4 years after that.
Wow.
Wow.
And so it's just like all of this stuff. And I think what was so beautiful about it was we do not come from the same place. We are not the same people. Very different people. And I thought what was the most beautiful thing about that was he had always talked about not having great relationships or really any great relationships with straight males. And so there was this like parallel process of like, I represented something different to him. We come from such dynamically different backgrounds and became incredibly close over that time, which I think is kind of another aspect of this, that we should be exactly who we are in therapy sessions. And I think, self-disclosure becomes kind of a dynamic topic to talk about, but we should be exactly who we are, because that relationship is the thing that ultimately is going to be the thing that carries the therapy forward. I kind of forgot where I was going with that, but I think that was one of my biggest takeaways was if I had gone in and been anything other than exactly genuine, he would have fired me in a minute. And he should have.
And you being genuine was you just kind of authentically taking ownership of knowing that you were something that represented like painful wounds from his past.
Oh, absolutely.
And that was powerful. Like that ended up being a curative factor for him.
But if you would have asked me at the time, I had no idea that I was doing that.
Yeah.
This is all after the fact, and I think that's why it's changed how I think about therapy so much, that at the time I was, to be completely honest, so incredibly lost.
Yeah.
No idea what to do when I would go meet him. Like, so it's like all kind of post hoc analysis, but I'm like, oh, being human, being who I am, owning that we're different, actually was one of the biggest interventions, if you will, that actually happened.
Yeah.
And so I think that's I guess if there's a message to newer clinicians, like, we should be exactly who we are, because it can often offer like corrective emotional experiences. Because sometimes I think like when we're newer, we're like, what is the thing that I'm supposed to do? What is the goal of today? And not that we shouldn't think about those things, but you should think about those things in what actually feels genuine to you.
Yeah.
Because that's what people experience. They have no idea if you're reframing or whatever those
Externalizing the problem.
They don't know that. And I think a lot of clients don't necessarily care to.
No.
Right. So when you were first working with him and you were feeling kind of out of your realm, out of your depth, what helped you know what to do? How did you navigate that?
Yeah. I think another thing that I get very passionate or even kind of have a soapbox about is I was very, very fortunate that I had 2 mentors who continue to be mentors, 13 years later. But two older women clinicians that have been therapists for about as many decades as I've been alive that were both amazingly supportive and also very willing to give me very critical feedback. The supervisor I had at the time, Deb, phenomenal woman. Like, I think we checked in on that case easily once a week. And there was always this constant conversation of, do I need to pull you out? Like, she was very protective that way. Like, there was a lot of conversations on being so new, should I actually have that difficult of a case? And I recall what she had said to me was, because you're willing to be completely open and vulnerable and tell me exactly what's going on in the therapy, but also what's happening to you, I feel very okay supervising you to do that. But she was also very clear that the minute that I was in over my head, she wouldn't have hesitated to pull me out. And I knew that, which really, that helped me feel way more confident to be in that room.
Yeah.
Because I think when you kind of take all of those factors together, what I'm not saying in this podcast is to go outside of your scope of abilities.
Right.
I think that that is not good for you. That is not good for clients. You need to gain the experience you need to have to work with certain groups of people.
Yeah.
And I think that supervisors can be that. And I really do use the word mentor very specifically, that these people, one is Deb, one is Ruth, still talk to them all of the time. And both of them are like second moms. And I've always joked that like both of them are probably the two most critical people of me in the nicest possible way, which I think that's that like mutuality and respect about.
Oh yeah. They believed in you.
Yeah. I think it's kind of what we were just talking about, that helps us reach the potential that we have. And so I think if there is one piece of advice, it would be find that person with experience that's willing to help you reach the potential of what you're capable of safely.
Yeah. Like y'all definitely need at least one really good supervisor mentor, you know, whether it's a formal supervisor that's kind of signing off on supervision hours, or if it's an ongoing mentor. You need at least one. Not all of your supervisors need to be great. You can have a couple crummy ones, you know, just to kind of get the hours in, especially if it's like a on-site, more administrative supervisor. But with that too, it's like once you're, and it's easier when you're pre-licensed because everything is about kind of expanding your competency and working toward a higher competency. But even when you're fully licensed, you know, it's like that doesn't mean the competencies you established in your pre-licensure phase of development is going to be like the barrier to your competencies at that point, you know? So it's like pursue greater competency, but don't do that on your own. You know, that's what would be reckless when you start, you know, if you want to expand your scope, if you want to step into a new setting, like if I wanted to start seeing clients at psychedelic therapy, like I've never seen a client through the hands-on integrative process, you know, that you all use with the ketamine treatments. I'm fully licensed, like I can get certified, but that doesn't mean that I wouldn't seek mentorship and hefty consultation as I'm first getting into this with clients.
But I think that's what's so hard about this conversation and this topic is even if you are not a therapist that specializes in grief, even if you are, you know, you're a solution focused therapist that's working with, you know, a teenager that goes through a huge tragedy, like you might not specialize in it, but this is going to happen at some point. So then it is kind of knowing how to navigate that, knowing who you can rely on or talk to through these different, like if you have a good mentor, if you have a good supervisor, being able to talk with them about what's going on. But like you can be a therapist that specializes in this, but there's also, you're going to be thrown curveballs.
Oh yeah.
Well, and I think one underlying thought with all of that is the willingness to be honest with ourselves, which I think it sounds like something that should just be inherent, but I do think we have to work at it in that, can I be honest with myself enough to know when I need to step back, when I need to go get a new training, when I do need consultation, when I do need critical feedback. One of my mentors, Deb, used to always say that one of the greatest skills a therapist can learn is the ability to accept critical feedback.
Yeah.
And I don't think that that's not something that we necessarily like teach little kids, right? Like, I think we're talking about tragedy, but like, think of, we're not necessarily taught that in school. You get a grade or whatever, but like, how do you develop that skill to be honest with yourself and be able to receive sometimes harsh feedback if it's constructive, obviously, but like, that's a huge thing we need to have to grow as clinicians. And I don't think that's ever done.
Well, and Lucas and I are both millennials, so we got medals for everything. So
I earned my trophies.
I think technically I'm 38.
I think you're a millennial then.
Okay.
You're a geezer millennial.
You're an elder millennial. That's what you are.
Interesting.
So what can people start doing? How can they start building up resources for this, especially the therapists tuning in that maybe haven't been hit with this yet? It's like, what can they start thinking about?
I guess the first thing that comes to mind is sitting with yourself and asking the honest question, how do I deal with tragedy? We've all had them. We've all had traumas, some bigger, some small, but really taking almost a third person view of, when a tragedy happens to me, how do I respond? Is it healthy? Is it maladaptive? Because I think we all come from families that, I always make the joke that it's not surprised when people become therapists. Not saying it's all of us, but like, I think more often than not, I think when we seek this field out, it's because something has happened to us, or many somethings in which we've had to overcome, triumph, learn how to deal with difficult situations. I know that's true for me. And then asking yourself, how do I understand what tragedy is? How do I understand what true suffering is? And how have I found ways to accept that into my life?
Yeah, so I think a big part of this is just kind of doing what you can ahead of time to come to terms with, like you were saying, just the reality of suffering, the reality of tragedies that strike people constantly in this world. Like it's a given of existence. And so I would always be intentional to do that when I was teaching full time, to just start, even like have people writing out lists of like 100 horrible things that happen to people on a daily basis, and so when you're confronted with it and a client brings it up, like, it's not brand new. It's not shocking. It doesn't like throw you out of your chair and paralyze you, because you've done a lot of that meditative, kind of mindful work of coming to terms with the fact that, yes, horrible things happen to people. Also, I'm no less vulnerable to them than anybody else is, nor are my clients. But that can only take us so far. Like a lot of, people start practicing therapy, the folks who do undergrad right into their master's program without skipping a beat. It's like you're practicing by the time you're 22, 23 years old. And it's not terribly uncommon for 23, 24, 25-year-olds to have not yet been struck, by a significant tragedy. And when it, kind of, if you're in that camp, it's like, that's of course nothing to feel bad about. It's just circumstance of existence. The first one's going to be rough. The first one's going to be challenging, and there is going to be a first one. It's like the two types of therapists are people who have experienced a personal tragedy in their life as they're practicing, and those that are about to at some point in the future. And so what, do you want to talk a little bit about your first experience of tragedy hitting you?
Yeah. I think in my mind, there's like the two things, right? There is what happens to clients, and then there is what happens to us. And I think talking about that very first client was an amazing learning opportunity to try to figure out, what do you do when a client's facing something unimaginable? The other one is what happens when things happen to us, and what does that do to our clinical practice? And I think I've been more and more open about it. But about a year ago, my wife and I lost a child with a stillbirth at just over 8 months. And we had been trying for like 5+ years, which was, I'm not sure what the right words for it are, like painful, but that doesn't begin to describe
Yeah.
how soul crushing it is. I've begun to share that in more and more circles, that those are life circumstances that will happen to us. And I think kind of lost our child, and then about 6 months later, my wife lost her mom. So last year has been just a lot of different losses that were really profound. And one of the reasons that I share that is, one, I think it's just, we should be open about our own experiences in the right circumstances, with the right people. And I'm very fortunate that I have a lot of friends and family, colleagues that are phenomenal humans. And so I think now I bring it up just kind of in this conversation that, what do you do with that? And your mind goes to kind of or at least for me, it went to two different places, where at one moment you're so completely overcome with emotion, you have no idea what's going on, and no idea what to do. And then in the next, you're trying to be very overly pragmatic, and what I do with clients, and here's this, and it's a whirlwind. And I would say that in this circumstance, and it's going to be completely different for everyone, but I think having people in your life that are amazingly trustworthy and supportive and know you, but can also, again, give critical feedback. So I think the biggest question was, we took, I think my wife and I took a month off. And that was the first kind of easy decision, which is there's no possible way that I can do clinical work in that time frame. There's a lot of complexities with that, with jobs and employment and all of those different things. And I think for my particular situation, I could do leadership stuff, but there was no way that I could see a single client in that time. And then a lot more nuanced questions started to come up. When do I start seeing clients? Do I tell my clients? Some of them knew that we were pregnant because I was actively planning on being on leave. Do I tell them? Does that disrupt them? Does it hurt them?
How do you not tell them?
How do you not tell them?
Yeah.
And all of a sudden you're there when you actively plan to not be there, to be on leave.
And they're inevitably going to ask you about the baby.
Mm-hmm. I think that, like, I work really closely with Kyle Keller here on a personal and professional level, and I think those were a lot of conversations with him. And in a lot of ways, what ended up happening was he was the one that called all of my clients and said I was going to be out for an extended period of time. Didn't tell them then. But when I started scheduling with them, the answer wasn't, to be honest, it wasn't a one-size-fits-all.
Yeah.
Some clients I told exactly what happened that I've known for a long time, all of that. Some to be honest, I don't know that they noticed that I was back and didn't really know that there was going to be that much time off. So it was a very nuanced answer for all of them. And so I think those are some of the pragmatic questions. The part that I think is probably really worthwhile to talk about in here was, what did I do to navigate that?
Yeah. Especially when, like, did you find yourself experiencing that dynamic of the clients who you said you had known for a while, you've worked with for a while, where you were just kind of direct with them about what had happened? Like, were you sensing their empathy and sympathy toward you?
Definitely.
Yeah.
Definitely. I think those are some more of my long-term people that, you can't work with someone for years on end and, like, you don't have a very personal relationship. And that was really nice. And then, I think you're constantly asking yourself, like, yes, you tell them and give them space to process it too, because that's a loss for them too.
Yeah.
You can't work with someone for years and you're invested in them. But I think not forgetting the clients are also invested in you.
Yeah.
And so giving space for that, but then also therapy is about the client you're working with. So steering that conversation eventually back to they see you to get healthier.
And that's like, I can see how that process could play out in a way where like it is like when the clients are kind of tending to you or wanting to tend to you, wanting to check in with you, that can be facilitated in a way where it's still therapeutic for them and it's still about them, like how, and it makes sense when you just think of the alternative. Like, how could you argue it would be therapeutic to kind of command that a client isn't allowed to care about you?
Well, and I went to undergraduate school, and the part that I've always loved about Adlerian psychology is the concept of social interest. That I think, not that everyone has to go out and study Adler or be Adlerian, but Adler would always say that a person is sick unto the point that they lack social interest. So I agree with you fully that in a lot of ways, clients being able to give that empathy or expressiveness back was actually, I think, a sign of their healing and their own journey.
Yeah.
That they're able to, because like therapy is a microcosm of life. Whatever they're doing with you, that's happening outside of session. And sometimes that's really good, or sometimes it's the problem in and of itself. But I think for a lot of my long-term people, it was really neat to see that there was a lot of caring with that. And I think that some of what happened for my wife and I was challenging for the obvious reasons, but also challenging in the way that I tend to think that things happen in life, there's reasons for them or there's lessons to be learned. And a year later, I'm not entirely sure what the lesson is.
Yeah, it can take a while sometimes. Or never at all.
Yeah.
I think in some situations. I think that, and that's a tricky part about tragedy is it's like, yeah, I mean, plenty of times you can find growth from it, but like what truly is the meaning of it other than us just being biologically mortal?
Yeah, I mean, I think the one thing that I've thought of in my own life, I don't necessarily feel like I've learned whatever that big lesson is, or maybe there isn't even one, but I think one thing that I've thought of is that when something can completely destroy us so thoroughly, it also meant that there was that equal amount of love and compassion.
Yeah. And
so I think, I don't know, I can't go as far to say that I found a silver lining in it.
Well, I don't think that's necessarily a silver lining. It's like, that's just meaning, and meaning is important. Meaning is incredibly important. We don't take meaning seriously enough. And that is meaningful, that it is a reflection of your capacity to love, and to experience all of the things that come with love. And it's like we can't open ourselves up to that without opening ourselves up to the pain of losing that, and that changing or going away. And so even like in our personal tragedies, when they do come up in session, in scenarios that Kyle's talking about, it's like, yeah, there are a lot of ways we can use that, rightfully for us, to some degree, but also as opportunities for the client. Like especially if it's a client who like doesn't really know how to support people in those situations. It's like, and you can notice that in people, like when they care, they're affected by it, but they are paralyzed in what to say or what to do. Like I could see myself doing something like maybe like that first session back, they knew that it happened, check in with them, give some space for them to say what they want to say, but then maybe intentionally start talking about all of the unhelpful things people have said to you, like all the unhelpful ways people try to show up and, provide support.
That actually brings up something that I think is on the topic of navigating tragedy. Often, I think when something horrible happens to someone, there's this phrase that so many of us use that I would recommend finding a way around, where it's, let me know if I can help. And it is the most well-meaning phrase from absolutely everyone. And I think even as clinicians, we do it. But I think that was one of the first experiences in my life where, you know, even parts of my family did it. And I'm like, it's anger inducing.
Yeah.
You're not angry at them, but it's anger inducing because there is nothing that's going to help with that. And so I think some of the most helpful things people had said is, I'm around.
Yeah, I'm here.
Yep.
I see you.
Yeah, I think those were probably the most touching things people did, where there isn't a thing that we get to do with some tragedies. There's no magical set of words that even the greatest clinician in the world, there's no formation of a sentence that's going to make the suffering any less. I think the things that ultimately can help heal is just having people around that are willing.
Yeah.
And I think understanding that each person's navigation of tragedy is going to be really different. Like, I think for my wife and I, there's like this similar parallel trajectory. And then there are very stark differences in how we deal with that, or different things that will trigger that. And so I think as clinicians, one of the best things we can do is understand how we deal with it and help provide a framework, or a helpful framework, but also watching how your client navigates that.
Yeah.
Because it's not going to be the same as anyone else when it's the really big tragedies that are incomprehensible.
Yeah. Yeah, and when tragedies do hit you, it's when it's your first one, it's like, pay attention to what's helpful, what's not helpful. It's like, learn from yourself in that moment. You know, what is it that you're needing? What is it that you're not needing? It's like, how had people shown up for you in ways that were helpful? How did they show up for you in ways that were not necessarily helpful, you know, or turned into more of a burden? You know, and I would comment, like, when this struck you, that was like right when I started working here full time. That was like right when I met you.
Yeah.
So like we always knew of each other, you know, and crossed paths a couple of times. I'd always be sending interns your way.
Yeah, you did.
And like I remember, like I felt like I could feel the pain that you were carrying. You know, it's like it wasn't hard to see it in your eyes, and it was like so naturally I felt compelled to like want to do something, to want to say something. I didn't necessarily know what to say, but then I mean I ultimately realized that like I didn't have to say anything or do anything, because you were already surrounded by people that loved you, that were doing that for you.
I think on the felt sense, that was the most helpful thing from most people, was just, it wasn't anything that they had said. It was just an acknowledgement.
Yeah.
And I think that's something that I think when inevitably something happens to a client, that is what I would offer rather than a set of words.
Yeah.
Presence alone is, I think we underestimate the things that we're like, the presence that we provide people, and sometimes we overestimate the words that we say.
Yeah.
And I think when it's like, that is probably one of the biggest takeaways, at least as a clinician, is that like words were nice, but it actually wasn't the words. It was that someone was thinking and were there to do something if needed. And the irony of it is, there wasn't ever a thing I needed someone to do, or even really wanted anyone to do, because like that wasn't going to do anything. It was just the willingness to be present in it.
Yeah. Yeah, and before you go about trying to make someone feel better, it's like, make sure they're ready to feel better. Make sure they want to feel better. You know, I think that's a big one that I've certainly learned, you know, and sometimes it's just a matter of simply communicating to the person, because it's always good intent and well-intended, but like just to say like, I'm not ready to feel better yet.
And maybe there are some tragedies that we don't want to feel better from.
Yeah. Yeah.
Like for me, like I'm okay feeling awful about what happened forever with that.
Yeah.
Yeah.
Like, not to be to the point where you can't function and whatever. I don't mean that, but like, I think it's okay that I will forever see that event as something horrific.
Mm-hmm.
I can live with it and I can navigate and I can talk about it like all the way to this podcast, but like, I don't really have a desire to feel better about it.
Mm-hmm.
Yeah. Well, I'm glad we're like best friends now.
Yeah, man.
I really appreciate you sharing that. You know, it's like
Mhm.
that stuff. It's powerful. It takes courage. Hopefully, it's meaningful to folks. You know, I think that's how. Yeah, I mean, it does help us feel a little less helpless in our helplessness when we're in the company of people who have also experienced helplessness. You know, it's like we can be helpless over these things together. So I'm glad that, yeah, you had the right people around you. And for the folks out there, you know, maybe that's step one too. If you don't have those people around you, start putting them in place, you know, because it's not just going to be a matter of tragedy that you're going to need community to help get you through. You know, community just in general is a significant aspect of thriving as a therapist into the long term. So
Absolutely. Thank you so much for joining, Kyle. Thank you for sharing your story and all of this wisdom for us as well as our listeners. It's really valuable. Any other last words of advice you'd want to share?
I think people, for everyone that is doing therapy with people, you're always doing more than you think you are. And like, just not, it's not always about the words or things you say. It's just the presence and like showing up for people will always go further than we give it credit for.
yeah.
Thank you. I love that. Well, awesome. Stay tuned for our next episode with Kyle, where we are talking about, what are we talking about with Kyle? Oh,
Working with clients
with an opposing
with an
worldview,
opposing worldview.
which is perfect because Lucas and I disagree on everything.
Everything.
Awesome. Thanks, guys.
Thank you.